Week of Mental Health Awareness Month on Wilson's World. This morning, Wilson is speaking with doctors from HopeWay in Southwest Charlotte.
Hello, good morning, everybody. Wilson's World here. I have two doctors joining me right now. We're going to be talking about how July is Mental Health Awareness Month, Minority Mental Health Awareness Month. And the two doctors here from HopeWay, Dr. Coley right here, Dr. Kashimawo right here with me. I got it. There you go. I had to think about it for a second. I got it. Hello. Good morning.
Good morning.
Listen, let's just jump right into it here. I know that this month is, and kind of in the timing with the pandemic and COVID going on, health issues in different communities have been highlighted. Some needs in minority communities have kind of got the spotlight here, but these are issues that have been there before COVID, and it's interesting how now we're highlighting these, and I think mental health really kind of plays right along into that.
Absolutely. This is an annual campaign that started in 2008 to really highlight the need for mental health care and access in minority communities and communities of color. So once a year, we really highlight that importance, but it's a concern that we have all year round. It's a concern that we have in all of our communities, but there's a particular need for greater access to mental health care and appropriate treatment in communities of color.
Dr. Coley, let me ask you this. There's a stigma with mental health really throughout all communities, all parts of town, I guess you could say. Is there anything in particular with different communities and the stigmas that go along with them?
Yeah, so I think if we use kind of a historical lens, we know that particularly for people of color, there have been centuries of oppression, and that's definitely kind of transitioned more into structural or institutional disparities, which can have impacts on socioeconomic status, and then there are downstream effects from that. Access to care is certainly limited, particularly within communities of color, and we know that for many communities and culturally, talking about mental health can be taboo. Within families, it can be very difficult to bring up those subjects. People don't know how to access care or how to really talk about it. And additionally, there can be some apprehension or mistrust, particularly with just finding care.
Well, and that's one of the things, having access to care is one thing, but then the stigma that comes with some of this is it's almost like we like two mountains trying to just get healthy, having to cross those mountains. Listen, we're going to have more with the doctors coming up. They are with HopeWay. We're going to have a link up at WCCBCharlotte.com, and we're going to tell you more, hoping that these conversations we're having that might be a little difficult at times, at least help get the word out, help with awareness, and help rid us of that stigma right there. We got more Wilson's World coming up in just a few.